So what tools can you in the insurance industry give to consumers? How can we look at maybe reforming the way in which people buy their health care? Not the premium, but rather the actual service, how they buy it. And I understand you can't do it with emergency care, but if I go in, there's, you know, I live in a relatively large city, 150,000 people. A lot of places offer MRIs. And each one of those locations charges a different rate. Yet that information is not readily available to me as a consumer. And I think that is a part and parcel to us doing a better job of controlling the costs that go and drive up healthcare premiums. So if you could answer that question, I'd appreciate it. What are you doing now, and what could we be doing to give those tools better to consumers?
Gentleman's time's expired, but the witnesses can answer the question. Go ahead.
Thank you.
Congressman, I can answer that for my company, WellPoint. Several years ago, we embarked on a journey to increase the transparency so that consumers could more easily compare the prices of commonly used services within their geographic area, because you're right. There is a large disparity between an MRI in one part of the city and another part of the city, a cost for commonly knee replacements in one part of the city versus others. So we created what we call Anthem Care Compare, which is a website that identifies the top 34 elective type procedures, and a member can go into that website, type in their zip code, and it will identify different providers within the area and the costs associated that would be charged by the different facilities for those areas. Plus, we try and tie in as much quality, publicly available quality information that is available to members, so that if you're considering having your knee replaced at a certain facility, how often do they do that procedure, and what is the success rate, what are the readmission rate for that? We've rolled that out in many of our markets across the country, and actually we're now providing that service to many Blue Cross Blue Shield plans across the country.